We'll call to order the Board of Health meeting for March 28th, 2019. Can we please have a roll call? I guess I'll start. Brian Beggs, Chair.
Ben Wick, City of Spokane Valley. Vice Chair.
Kevin Freeman, City of Millwood.
Ray Byrne, Interim Administrator and Environmental Public Health Division Director.
Bob Lutz, County Health Officer.
Mary Cuny, Spokane County Commissioner.
Chuck Hafner, appointed citizen.
Don Condon, appointed citizen.
Josh Kern, Spokane County.
Andrea Frostad, Citizen Rep.
Ann Snuggle, Recording Secretary. Michelle Fossum, Legal Counsel.
Linda Thompson, City of Spokane Valley.
Okay, we have one person signed up for citizen input today, and that's Jacqueline Gallion. And before you start, Jacqueline, just let the record show that Councilmember Burke is here.
Thank you. Okay. I will be at the Senate hearing Friday morning opposing a bill to remove the non-medical exemptions for the MMR. I am watching this bill being promoted with bogus information. These include vaccination rate statistics that are 15% below the actual school reports. Stop using the IIS opt-in database. Clark County is not a hotspot. The schools have a 94% MMR vaccination rate, but the county health department is intentionally not using the school rates because they are too high to support legislation. The false claim that exemption use is rising. The Washington State MMR exemption rate is down from 3.1% to 2.9%. Personal exemptions are down, and all types exemptions are down. False claims that measles will kill 1 or 2 out of 1,000, that is not 1,000 measles cases. That is 1 or 2 of 1,000 hospitalized, and overall it is under 1 in 10,000. Here in Washington, in 1959, there were 16,500 cases with a single mortality. In 1960, there was 13,500 with a single mortality, dropping to 0 in 1968, 12 years before school rules. The complete fabrication that there was at-school exempt child an at-school exempt child to immune-compromised child measles infection resulting in death is absolutely false. In the last 29 years, the only Washington case that might be measles-related was a fully vaccinated adult woman with immune issues who was exposed by another adult in a clinical setting. There was no children or schools involved. Exemption use had nothing to do with it. The woman was never symptomatic for measles, never diagnosed with measles, and they only identified measles virus post-mortem. The Department of Health is crying wolf. Where's the checks and balances? Who does the Department of Health answer to when they mislead elected officials and the public? What's the end game? And is there a limit? The inability of people to be able to think critically is really disturbing. I have learned that virtually everyone in public health of Washington belongs to affiliation groups of unelected policymakers with their own agendas that don't align with Washington citizens. Groups called NACCHO, ASTHO, AIM, WSMA, WAAP, and more, who all have unrestricted access to elected and health officials while we're relegated to a 3-minute comment once a month. All of these groups have elimination of non-medical exemptions as formal adopted policy with zero input from the citizens of Washington. The conflicts of interest are staggering. Rockland, New York just banned non-vaccinated children from public places for 30 days. Banning healthy kids from places and schools for fear of disease is no different than banning homosexuals out of the fear they might have AIDS. Are we setting the stage for hate crimes? The Department of Health is creating an environment where it's acceptable to harm a non-vaccinated individual. This is no longer about vaccines. This is a civil rights matter. Thank you.
Thank you, Ms. Gallion. And that is the end of citizen input. I'd like to recognize for the record that Councilmember Stratton is here as well. On consent agenda, we have 2 things, meeting minutes and vouchers. So meeting minutes of February 28th, 2019. To entertain a motion to approve.
Second.
Okay, it's been, motion's been made and seconded. Is there any discussion? All those in favor, please indicate by saying aye.
Aye.
Opposed, nay. Any abstentions? The minutes for February 28th, 2019 are approved. Next are the vouchers from February 1st to February 28th, 2019. Is there a motion to approve them?
Chair Biggs, I need to.
I'll get to that when we get to discussion.
Okay.
Yep. Motion's made. Is there a second?
Second.
Okay, there's a second. Now, any discussion? Ms.
I
Thompson?
need to recuse myself as the Greater Spokane Substance Abuse Council has a voucher in there.
Okay, thank you. So noted.
Right, next time.
Any other discussion? I'll just mention that we did do our new procedure this time of people who had any concerns, put them in, and we discussed them in executive committee. So thank you for the people that did look closely and raise those. And again, we'll continue to send those out ahead of time so that if anyone has a concern, we can address them. That said, all those in favor, please indicate by saying aye.
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 Any opposed? Nay? Any abstentions? All right, the vouchers. One absent, yes. The vouchers have been approved. Before, I think I spoke with Ms. Fossum, and the executive session is not going to be an action one, so can we do it later? So
Yes.
we only have to clear the room
Yep.
one time? Okay, so we'll defer that to later in the agenda. Okay. Then we're down to the proposed 2019-2021 Spokane Regional Health District Strategic Plan. And again, by background, for anyone here today or watching this later, this is our third meeting on this topic. The first meeting, we went over the previous strategic plan and what worked and where we had challenges and just discussion about that. And then the last month's meeting, we discussed what staff was proposing for a strategic plan and got some comments from the board. And now we're here to discuss it further and consider final approval of the proposed or amended plan. Lindia.
Yeah. Good afternoon. So in your packet, there is a one-page flyer that puts it together as a really nice high-level overview of what we're proposing. So if you remember, just to give you a little background on how we got here, last year we did a community health assessment process, and their number one issue was family violence and trauma. And so we are proposing that that is one of our priorities. And then the second one, behavioral health conditions, came out of an internal process that we did with the staff and really aligning with Better Health Together and the Accountable Communities of Health on opioids and substance misuse, the mental health substance issues. And then the third priority area is around cardiovascular disease and behaviors, which is the number one cause of morbidity and mortality in our community. And as a health department, we really feel like we need to take that one on, aligning with many of our programs here. So the priority areas are at the bottom of the handout, and they were purposely put there. So if you start at the top, we decided as an agency we wanted to do a more cross-cutting approach, which is really to work upstream and be preventive. So we want to do an educational campaign on how to do that, and then really look at policies, systems, and environmental changes to really leverage our partners and work together on ways that can have the most impact. And then we want to continue this eye on equity. We have a lot of populations that are underserved and have higher health disparities and barriers to health. And so we want to really move along in that area and keep that at the forefront. Then in the middle of the handout are kind of our strategies to get there. And through those strategies, we will be running all of the priority areas through that. So systems network analysis, a client referral system, and all of those different things are going to be based on our priority issues. And then our hope, 3 to 5 years from now, we'll actually see a difference in some of the performance measurements and data points that we are monitoring. So we are asking for the Board of Health approval of our strategic plan, and we'll then dive right into implementation.
Okay, comments or questions from board members? Councilmember Burke.
Shocking that I would speak. I felt like we had a pretty good conversation after the Board of Health meeting last month to talk more about how we could see homelessness on this, and we'll go over our legislative meeting that we had later in the agenda, but one of our priorities is focusing on the strategic plan and building policies that we either want to support or create off of our strategic plan. And I know it's not limited to, but we're focusing on it. And so I do think that we need to add a component of homelessness on our strategic plan, as it is in the paper every single day. It is something that our community is heavily focused on right now. And it might not have been the biggest focus from the Priority Spokane, but that was 1.5 years ago now. So a lot has changed. And I'm encouraging us to maybe add it to the strategic plan as a priority area. And I think it will fit in well with, you know, all of the other components.
Other comments? Other comments or questions?
I'm going to move approval of the Spokane Regional Health District Agency Strategic Plan for 2019-2021 as presented.
Is there a second?
I'll second.
Okay. There's been a motion to approve this proposed strategic plan. Any discussion, proposed amendments, et cetera?
Yeah, I think, sorry. Before we approve this, could we have a discussion on the homeless topic? And also, if maybe we could, I was gonna propose a motion to add homelessness on as a priority, but I wanted to discuss further, so.
Councilmember Stratton.
I do have a question. When we talk about these priority areas, and then we talk about homelessness, is there a way, and I'm not sure how I'm thinking about this, but it seems to me that homelessness is the outcome of a lot of social and health issues in the community. So, I mean, I look at behavioral health conditions. You see a lot of people on the street that are mentally ill. A lot of people on the street because of family violence and trauma. Is there a way to, I don't know, connect that in there, or to, because I get it, I mean, I see it, that
Right.
homelessness is really kind of the outcome of a lot of other things.
Yes, and that's the way we're seeing it also, that the priority areas are the contributors to a lot of further downstream outcomes, such as homelessness. We have woven in homelessness through a lot of our activities, and it is one of our FAB outcome measures that we put forward that we will continue to monitor. I think the desire in not putting it on there is trying to really get this notion of prevention and working upstream.
The upstream piece, okay.
Mr. Hafner.
So, Randy, what you're saying, that within this format, that there's many other strategic areas such as homelessness that you will be involved in your strategy to eventually get to.
Yes.
So it's just part of the huge and enormous area that you were dealing with. So I
Yes.
just wanted to make sure that was understood.
Right. In working with our client referral strategy, one of the areas that we're really going to look at is internally our homeless clients and helping connect them to services. We haven't been intentional about that in the past, and we'd really like to do that work.
Councilmember Burke.
I understand it's in here and everything. I just want to make sure that we, as a board, understand that these issues are prevalent in our community, and that when we go back to our strategic plan in our policy meetings, when we bring up these issues, if it's not a priority on here and we say we're going to support bills at the state level, or, you know, write our own bills, how do we go back to the strategic plan and say, well, see, this is why we're supporting it? If it's not on here, that's my question, is because I don't want to get us into a place where we're looking at state policies and say, well, because it's not on here, because this is what we're focusing on for our policies, then how do we how do we get over that hump is my question then. If it's woven in here, is that enough for us to focus on policies to fix these problems?
Mayor Freeman.
I think we have a number of other issues that are priority areas that are woven into this document. I mean, substance abuse prevention and treatment is a priority. I would take it. We don't see it called out in here explicitly. But I think that the idea is in the underlying document, not this one page, but the underlying document that we all got a chance to look at, is that is in there. These elements are part of that document. And so this one page does not drive the strategic plan.
Thank you.
Yeah. So my question is, you talked about it reflect in the change points at the end, and that's how you know how these programs, how it's being implemented and how it's doing. Is it possible to include in those endpoints homelessness, and how would you rate that? Like on, you dropped the statistic, there was 50 people had died and 50 homeless, and or is it the number on the streets, or how would you do that, or like the number of suicides? What are these endpoints?
We have a number of them, and one of them is around, I think it's maternal, single mom homelessness is one of them, which we do have a measurement that we can monitor. There's I think 10 of them. So suicide prevention is one, food insecurity, substance use penetration rates, mental health penetration rates, which is, services and how people are getting into services. So there's a number of them, and homelessness is one of them.
So I just have a question too. So when we do, the health officer does his reports, just because we're following us through the whole year, is there a way to kind of put some of those statistics up at some of the meetings, like the suicide rates and single mothers with homelessness, and is that possible?
One of the things we could do is we have a recently developed website called County Insights, and all of our public health indicators are on that website, and we could have Stacy come in and do a demo of the site. They just updated all of our homeless data, and they could show you that report that's on that website. But it covers substance use, mental health, nutrition, physical activity, cardiovascular disease, all of the different areas.
Commissioner Kearns.
And I apologize for not being in attendance at last month's meeting. We had a county leadership retreat. But last month, was there any discussion about where financial stewardship plays a role in any of this as far as the strategic plan? I mean, every time the budget rolls around, we talk about how tight funds are. All this is taxpayer dollars. At what level does financial stewardship play a role in what we do here? Because I see that as something that's missing from this.
And just to clarify, so do you mean financial stewardship of the organization?
Yes.
Yes, okay.
So I guess I would respond to that we consider that organizational infrastructure, and all of those things are something that we maintain through our executive team and our leadership, not only just financial, but also workforce development, IT infrastructure, and all of those different elements. And I don't know, Ray or Mike, if you want to add to that.
Well, I would just think, then is that something that should at least be in the vision or the values on this document?
Okay.
Thanks. Part of the focus is trying to change the way we've done things in the past, so move in a new direction. So the strategic plan to me is how do we implement this into all the divisions, including environmental public health? How do you take some of these things, what could they do in their areas to get some of this work done? It's not necessarily it's going to cost us millions of more dollars to get this done. It's more refocusing some of the work we do and moving in a direction on the strategic plan. And it doesn't mean every program verbatim has to jump on and then what are you proven to do you're doing in this area. But our theory is, our hope is as executive leadership team is to move our agency forward in these areas. And so I don't see the financial part being a major ordeal. What it's going to do is sort of refocus us on what grants we go after, what grants we ask for and what work we're going to do with those grants. And so I don't see our budget expanding largely. We've had strategic plans the last 3 to 5 years, and we did the 3 to 5 years before that. And so there was always a focus. This one we've been a lot more diligent of looking what are we trying to accomplish with this strategic plan.
Okay, but I mean, regardless of if the budget expands due to this strategic plan, I mean, the financial stewardship of the existing funds that we have as well, I would think would play some sort of underlying role, because everything that the health district does has a financial aspect to it. I mean, so to me, it just stood out as something that was missing, that I think should be at least highlighted, at least in the vision, or in the values, I would think, on this.
Okay. I don't know how it was in the past. Did we put financial information in there, or is that what you
We've
thought?
gone back and forth from strategic plan to strategic plan. Sometimes we put organizational infrastructure development piece in the priorities or the goals, and sometimes we have been more external out-facing. This time we chose to kind of just really focus on these priority areas, because this is the first time our community really came together and did this broad assessment process. So we decided not to do the organizational development piece in it. We've done it in the past, and it's kind of fallen back to existing work groups that oversee the work. And so it was kind of like we already have that infrastructure in place and that process in place. So it didn't make sense for us to put it in the strategic plan, because we were already doing that work. I mean, I think you know that we have a excellent comptroller and finance department, and we have a great process that we go through with the executive team on how we monitor our budgets, and you know, we're audited every year and all of that. So you know,
yeah, no, and I don't disagree with any of that. I mean, we see, I mean, I think you've got a great staff here, you got a great finance team. It's just, I don't know, I think I've made my point. Sorry.
Councilmember Thompson.
I would like to agree, as I'm looking at this and thinking, this is a really nice page and clearly shows what's being done, but for someone who doesn't understand community organizations, nonprofits, understanding what's behind each one of these, I really agree with what you're saying, Commissioner, that under the values, because we are investing money in the oversight and making sure that the grants are spent out right and the finances are done well, I think it's a good idea to put something in. We've already got the word integrity there, but fiscal integrity, fiscal stewardship, it's integrated in everything we do here. And I think as a board member, that gives me a sense of belonging of this, because that is what we do here, is to really look over.
Mr. Hafner.
I don't recall any program that we have initiated or have been looking at that we haven't first made sure that when it's completed, that we have the financial amount of money to take care of that particular project. And at this stage, I can tell you that from our conversation in looking for a new administrator and talking with staff and division heads and so forth, we're finding out that there are many, many projects that have been going on or have been going on in the last 2 or 3 years that need to come to completion. There's money available for those, but they need to come to completion because they haven't been so at this time. So when we talk about the whole theory of all the multitude of concerns that a health district has, there's no question in my mind this is somewhat generalized. But I guess you have to have faith the fact that staff itself is making sure that the things we're talking about, whether it's homelessness, the opioid concerns, or whatever, measles, mumps, whatever, but this staff has got their plate full. And with an interim directors trying to do not only their regular job, but also doing their job as administrator, it's most difficult at this stage to make sure that everything is taken care of, as some of you would like to see them do it 90% of the time. That's humanly impossible for the staff to do that. They do have homelessness, and Kate, you've been so involved in it that you need to kind of take off your blinders that we're concerned about homelessness too. Every one of us are in this community. We have to come up with a remedy that's going to solve it, which the city of Spokane has been working on for how long? Long time, trying to get all the other municipalities involved and so forth. But this health district agency is one that has a multitude of things that they have to look at, be concerned about, and every day something different comes and pops up that they have to make sure that they take care of. And I'm not saying that there shouldn't be special projects. I'm simply saying I would hate to see us saying we're going to have these 20 projects and we're going to make sure they have money. We're going to ignore some of the other things that have to happen. That's all I'm saying.
Mayor Freeman.
Thank you. So before we get too far afield here, I think one thing I'd like to go back to is that for some of the strategic plan development, you've been working on this now, the development of this particular iteration of the strategic plan for how long?
We started about a year ago.
A year ago. And prior to that, I was had the ability to be part of the strategic plan that was developed under Dr. McCullough, which drove forth a number of these visions, values, mission, everything that you see here today. I think that we, as an agency, are committed to financial responsibility. I think that if that becomes a sticking point, I think that would be one more of a strategic objective of financial responsibility, financial stewardship, as opposed to inserting that into values or visions. I think that would be a logical home for that, if that's truly what we want to get to. But I think these priority areas and the strategic objectives and the approach that have been developed by the team reflects a long process in the agency that has developed this strategic plan to carry forth the mission of this agency as we go forward with what we are attempting to accomplish in the immediate future. And so I don't think that this has been developed in a vacuum. I think there's a lot of data behind this, a lot of community input, a lot of effort that's been done by the agency staff and outside folks. And I think that as the electeds here, we can all have our pets. We could all sit here and we could go around the room and we could poll for everybody to insert a priority area or a strategic objective or something like that. I think that is not what the intent of the strategic plan is. The strategic plan is to focus and hone the mission of this agency and focus its resources and focus it on things that we have right now that carry both upstream weight and downstream weight. Appreciating the fact that these priority areas and the strategic objectives will affect other health, equity. Wow, I ran out of time. Health equity issues. I'm done. When the mic turns you off, you know you've talked too long, so I'm done.
Commissioner Cooney.
I think I'd actually like to reiterate some of that, because I think as I look at these priorities, we can't identify every individual priority that we have that is, really important to us, because, obviously for me, the opioid crisis is huge. And so it's like, do you call that out specifically? I think it's woven into the behavioral health conditions, just like I think homelessness is woven into both the behavioral health and the family violence and trauma. And I think by us talking about it today, we are now all on record to say it is a priority, but it's not one of these. It's an interwoven within these three priorities that we have. So I think that would give you the ability and the policy committee to continue on, because I think if we get so specific, it's not a strategic plan at that point. And so I like the broader areas that then other things are woven into to make that difference. So, thank you.
Commissioner Kearns.
So one of the reasons why I highlighted this is so at Spokane County, we have a strategic plan as well. We have customer service as one of our pillars, and I notice we have on here client-focused services is on the health district. We have public engagement. You guys have on this one here, we have community coordination. Employee development. We have engaged staff on this. The one pillar that we have that I don't see any reference to is financial stewardship. And the main reason I just bring that up, again, is everything that we do here, every government agency, everything that they're able to do is through taxpayer funds. Now we can say, oh, well, it's somewhere else in our documents, but I assume this flashy flyer is what we're going to push out to the public. And I assume that's one thing that I'm not the only person that's going to notice isn't on there, is the money aspect. We are funded by taxpayer dollars. There's nothing on this sheet that indicates that the cost or the amount of tax dollars, the amount of resources that go into any of this plays any role in anything this agency does if this goes out as it is today. That's the only reason I bring that up. I mean, you can agree or disagree. That's just where I'm coming from.
I have a question for you.
Okay.
If we were to put under values stewardship, just that word, is there any issues do you think that brings
I
up?
don't see any issue with that. Ray?
But isn't it implied, I mean, everything has to go through here, and budgets have to be approved on everything that happens, so I don't know why we have to point out this one, because it's implied with everything that goes on here.
I would hope so too, that everybody believes that we are fiscally responsible. If we need to spell that out, I guess we can, take it back to the staff and see if they're good with that too.
Yeah, and I would like to echo, as the very first step in this whole process that we took, one of the things that we did with staff is went back and looked at those three focus areas, so the mission, vision, and values. So the entire health district had input into what we did there. And so I think, again, echoing the financial piece, as we go through as executive leadership, each year that we develop our new budget, we take a look at where we are financially, where we have dollars to spend. And if there's cuts that have to be made, we make those priorities to do that. And so part of the process with this board is when we bring our budget forward to the board, if we're asking for additional dollars, whether it's in a focus area or anything else, I think that's the point at which the board then takes that action. ELT is very deliberate in the method in which if we feel that we are going beyond our financial responsibility, and especially since the board has set limits in which they would like us to hold as a minimum in our reserve account, we take that into consideration. So I think, if we're being asked to go back and modify these, I think we're kind of circumventing the process that we went through with our staff to have input into these three pieces. So.
Mr. Chair, I call for the question.
Yeah, I'm just thinking.
So just point of clarification. So what can we just, before we take the vote, reiterate what it is we're voting on? Were there any changes made or not?
There was, did you have the motion? Okay. So
I was discussing in your motion.
So right now the motion is as is.
That's correct. And so if there are any proposed motions, now would be the time to bring them.
So I would make a motion to just under values add fiscal or financial stewardship. I think if we've all said we do it, why would we not want to memorialize it in our strategic plan so everyone else knows we do it too? That's not a specific issue. It's not homelessness. It's not opioid crisis. It's something that we do. I don't see why we wouldn't memorialize that in this document then. So my motion would be under values, put financial stewardship.
Is there a second for that?
I'll second that.
Is there any discussion on the motion to amend?
So we as the board are amending the health district's driven strategic plan. Doesn't that have to go back through the process then?
We've never had this happen before.
Councilmember Stratton.
I would feel better if it went back. I don't feel right doing this, making a change without that piece.
I would be open then to put it under strategic objectives then.
But I think that's where we're at, is we as the board are adjusting the district's strategic plan. And so whatever we can propose to the district to make the change to the plan, they have to decide if they want to come back and argue with us about it.
We're a governing board. We're not an advisory board. We're a governing board. This is a decision that would be made at this level. Correct?
Is that
Well, I think we could all have opinions about that. I will weigh in just for, I'm trying mostly to be facilitating, not weighing in on decision, on it. But I actually do, my own personal opinion is that the strategic plan at the very high level, the mission, vision, those are board decisions. And the staff's done great work in bringing things and tailoring it. But I think for us to approve it means we agree with it. And so if we don't agree with it on something, I think it's respectful to say, hey, we'd like to change it, we'll send it back to you, get your comments back from staff to do that. But I think as an old, this is just me not speaking as the chair, I think that is what the board does. And I've always been a little bit, in this conversation for the last 3 months, having that same kind of question. And in my mind, it would be a board, but there's been a kind of a presumption, well, staff's done the work, so, okay, it's a rubber stamp. So I have not felt that way myself, but again, each board member could have their own opinion on that. It's not a ruling.
Is there a way that we could take this concept or idea back to the group and then come to a recommendation about how we would handle it within this document?
I do have a question.
So that could be, essentially, it could be a motion to send it back to staff with a recommendation and then defer a vote on that for today.
The precedent that we are starting is that for any program that the staff develops, which is under their umbrella, and we have to come back to make sure that there's a financial attachment to that particular proposal. I'm simply saying that the agency itself has an intensive budget review and where the money's going. And we all that have served on the budget committee understand and realize what that has been. And it's very, very detailed as how every part of the agency has an input for the money and what money they need in order to do their program. Now, when we approve the budget, we are automatically approving that particular situation. So why are we putting another area of burden, again, on the staff? And then the second thing is, I did call for the question. I don't know whether that was ignored or not, sir.
Apparently it was. And I'll have to go to your procedural concern. I think so. That would be a vote on whether or not to call for the question, and that's not a debatable point. So all those who want to call for the question without further amendment or discussion, please indicate by saying aye.
Aye.
Aye. And those who are opposed to calling the question at this time, nay.
Nay.
Nay. And so I'm going to call for division. So can you raise your hand if you were an aye on that? Okay, that looks like 6. And if you were a nay, and I don't know, I'll defer to our council. Is it a majority vote on call the question, or is it some super majority?
It's a majority vote.
Okay. All right. The question has been called on the existing without any amendments or recommendations. So all those in favor, please.
This goes back to the original motion.
This goes back to the original motion without any amendments. All those in favor of that motion, please indicate by saying aye.
Aye.
All those opposed?
Nay.
Nay. That looks like that passes. So, I think there was only, well, if you were a nay, raise your hand. I think there was, oh, I didn't hear your nay. Okay, so 4. So, and if you were an aye. Go ahead. Okay, the ayes have it. Passes as presented.
Thank you.
All right. Well, thanks for that, and please convey to staff our appreciation for that, and also that there's at least some concern. So, but thanks. Okay, on the chair report, I've got one main reminder, and that is that the awards and recognition reception for the Spokane Regional Health District, our 28th annual, is going to be April 17th at 8:30 a.m. In this room, I believe. and as many people as can attend. Encourage that. And beyond that, I don't believe I have anything from the chair. So we'll go to committee reports, and I'd like to start with the Transition Committee report. And I understand that Councilmember Stratton is going to share a report on that.
I get to talk. So in your packet, you should all have a copy of this and the search timeline. So that's what I'm going to be talking about. The Transition Committee met this last Monday, and I want everybody to know that we meet at 7 a.m.
Thanks, Chuck.
7 in the morning.
And you were early.
And I was 5 minutes early, thank you.
I have to give her a badge of courage. She was 10 minutes before 7.
Yes, I strive to be perfect in Chuck's eyes.
Of course, she thought she could leave 10 minutes early due to that.
So that meeting, we had a great discussion with Heather Gantz, who is the Waldron Search Director that we contracted with, to review and approve this administrative officer position profile. Heather and a colleague of hers spent, I think it was 2 days here in the city of Spokane. She interviewed and received input from the joint management team, the executive leadership team, and staff. They also provided an opportunity for any public comment in this process, in this position profile, and what people would like to see in the new position or the new administrative officer. This profile was then created using the agency's strategic objectives and input from the leadership, the Spokane Regional Health District leadership, staff, community members, and the Transition Committee on behalf of this board. We approved this, and our goal is to begin this targeted recruitment and outreach by April 1st. So I don't know if anybody's had a chance to go through it. I think it's a great document. I will say that I think I've got too many of them here. You can really see that they did their homework as far as talking to folks, and I was most impressed with under the successful candidate, the last paragraph that says the administrative officer builds trust, leads and empowers staff, and promotes a culture that embraces change for the better. The successful candidate maintains effective working relationships and gains cooperation through discussion and persuasion. The ideal candidate has a strong background in managing and empowering employees and believes in transparent communication. The administrative officer creates an inclusive environment that encourages collaboration, supports innovation, and creates opportunities to grow, learn, and develop. And I was very, very impressed with that last paragraph. I'll turn it over to anybody on the committee that wants to add their comments on this.
Well, I think the process went quite well. As you well know, we've been going since, last 3 or 4 months, and you're right, we've been meeting at 7 o'clock.
At 7 a.m.
At 7 a.m.
On a Monday morning.
On a Monday morning. So any of you that like to attend and be part of the conversation, we'd gladly open the door for you. We serve coffee and donuts. But I think that the process that we're finally coming to has been thoroughly gone through by everyone. We, of course, are looking at the job responsibilities, the description of what we want for a new administrator. And I think that the agency that's representing us, of course, as you well know, money was donated to this organization in order to do that. And I just feel so proud of the group. You know, we've worked as a team. There's really not have been a particular leader. I guess I've kind of been leading it from the standpoint I have more time than the rest of them. But each one, as you can see, makes a report to this board. and we worked in our unity, and we resolved any kind of concerns or problems we have. And I thank the staff, and unbelievable staff with their input and making sure that we would have a theme of what was going on and what has happened in the past. And that's what this committee has done and developed for you. And of course, you'll be able to, when we get down to the vetting portion of it, how many we have at that point in time, then the whole board will be involved in looking at all those applicants. Anything you want to add, Mary, Kevin, Ann? Good job, by the way. Where you didn't have a joke?
Because I was focused on this. I had it ready at 7 a.m. this morning.
No, that's all I have to say.
Any questions? I just have one, and maybe, I don't think you just said it, but the timeline for that, it's not in there as far as when we're trying to, or it's there.
Yeah, it's in there.
Okay, I see that. Okay.
April 1st.
I got it. Thanks. Anything else for this committee? If not, I'd move to the Finance Committee. Any report from the Finance Committee this month?
No report. The Finance Committee is, thought we had a meeting scheduled, Mike?
We do.
Oh.
18, but it's not been moved because I haven't applied that police folks.
Okay, because, yes, so we haven't met, but we were planning on in April. So we will reschedule that then. Thank you.
Great. And then, was there a joint meeting of the policy and education or not, or two separate? Then we'll start with you, Education and Communication Committee.
We are going to, the Policy Committee is going to be meeting, I don't want to take your presentation, but the Policy Committee is going to be meeting to outline some priority policies for that group to bring to the board. And then the Education Committee will look at those policies and then decide what we can do, the educational pieces, to support those priorities. And that gives us, I think, a more defined role in educational presentations that we should be looking at to educate the board and to expand on the policy, those policy priorities, if that makes sense. Linda, does that work for you?
I guess so.
Okay.
I didn't know about that, so, okay.
Well, and we just had talked about it because we had had some ideas that we wanted to follow up on. And I think the ideas that we've talked about in our one meeting will wrap into what they're discussing as well. So once we get that figured out, Dr. Lutz and I will meet again, and then I was going to send an email to board members and say, these are some of the issues, some of the policies. Let's get together and decide which ones we want to take on to educate, to use as an educational foundation.
Any other questions, concerns? All right, with that, we'll move to the Policy Committee. Councilmember Burke.
Thank you. So we had a really good meeting last week. We have lost Linda Graham as our policy staff, but we're hiring soon. So in the interim, we kind of worked up what the direction that we wanted to go as a committee. And we were kind of feeling a little bit lost in the last policy committee meetings before this of where our direction was. So I think we nailed down some really good ideas. The big part that we want to focus on is taking our strategic plan and outlining, pulling out things from that will help us generate ideas around policy we want to support either at the state level or look into options of what maybe isn't working here locally that we could write policies for at the state level as well. So to do our own policy changes at the state level. So I thought it was really good conversation. Our next steps is I'm going to meet with Dr. Letts to go over the strategic plan. For instance, maybe pull out homelessness from the strategic plan. Just had to throw it in there. And then drum up some of the ideas that kind of some of the patterns we see in the strategic plan. And then we'll send that to the education committee, like Councilwoman Stratton was talking about, where they'll come up with some, I guess, workshops or educational speakers coming in to explain some of the issues that are happening here locally, and that will help drive the kind of questions and conversations and policies that we'll have at our meetings to help us figure out what we're going to support at the state level, and maybe if we have, maybe there's some snags of things that aren't working here locally that we could write our own policies for, and have somebody support them in Olympia for us. So.
Thank you. Any questions, concerns on that report?
Good job.
Yeah.
Next up is the Administrative Officer report.
Okay, just got a few things here. Do want to highlight Councilwoman Kate's announcement that our policy person has resigned and left the agency. So the process that we're going through right now, we have solicited some PDs from around the state that have policy positions. We're taking a look at those. And then we also had some really good dialogue at the policy committee on what kind of the expectation is from the board and what the board would like to see on that. So we're going to try and incorporate those in. So that was great feedback. So where we're at right now is we'll evaluate those PDs, decide exactly what we need out of that position, and then we'll be going out to backfill that position. In your packet, you saw that there were some 2018 ELT highlights. I won't go through these in detail, but that just kind of highlights some of the activities that ELT took forth last year and some of the achievements that we made. A couple things that I would like to highlight is, you know, a lot of the things that we did last year, a lot of that was centered around streamlining processes and that, and there were 3 big pieces that were part of that. We brought in a new HR software package, which really has assisted with the recruitment and the hiring process, really streamlined that and our efforts there. And then we also brought in a new financial package, which this year was a little bit challenging just because of the brand new package, but it is making the process a lot more streamlined and easier to understand. And it gives us real time where we're at today as far as our finance budget-wise, both income and expenditures. And then also in our contracts process, taking a look at that, how we can streamline that and make that a smoother process moving forward. One of the other pieces is transparency and input from staff. Staff have made that aware that, you know, that is a focus area that they would like us to see us focus on, and you'll see some highlights in here and how we did that. So we are committed to moving forward. And then the last piece would be more centered around our cross-divisional work, in which we do both within the agency and then also networking with our partners out in the community. And I think you'll see that in that new strategic plan. You know, that's very intentional in the new strategic plan moving forward on how we can piggyback and work with external as well as internal pieces. So, any questions?
Questions, concerns? No? All right, Health Officer report.
I do have a couple more. I was just asking questions on that piece. Sorry. Just wanted to give a quick update on our FAB accreditation. We did have our final site review March 7th. That went really well. The review team was very impressed with how we proceeded forward with that, how we answered the questions that they had, and they were very encouraging on that. As far as report back out, we should hear something in the next couple weeks. First 2 weeks of April, we'll get a report back from the board. It's not a acceptance or not, but it's more focused on areas, if they have identified areas of improvement or areas of excellence. They did bring through and said that they identified 5 different areas right now, which they considered just after that meeting of Centers for Excellence. And one is our development as chief health strategist within our community. The second one was around the work centered around equity. The third piece was the strategic planning process that we've gone through with the old one and with the new one, the implementation on that. Our performance management, quality improvement within the agency. And then the last one was centered around our priority Spokane work. And those were pieces that they had just brought forward, and right after our committee, right after our review, had identified those as centers for, or pieces of excellence. So we may see more coming out of that. So we were really encouraged with that. And then also, as a piece of that, I'd just like to put a big thanks out to the staff, because this whole process is very staff-heavy. We had a lot of staff that were involved in the writing of the responses back to the FAB team, and then especially with Patricia Rhodes, who is our FAB coordinator. She has done an excellent job of coordinating this whole process, making sure that we're getting our reports in on time, making sure they're reviewed by the right people. So just like to say a big thanks to staff on that. And then the last piece I had was just an update on the space that was freed up when Veterans Administration relocated out to the valley. So we have identified that our disease prevention and response will be relocating up to that area. So right now we're doing some modifications to that area. Hopefully we'll see them moving up there shortly, which with that move, then it also allows us extra space for our assessment center, and then to move some other individuals in there that more closely align with the assessment center. So, and that's all I had.
Okay, no further questions on that. Health Officer report, Dr. Lutz.
Sorry, Mr. Chair, I'm going to have to step out here.
Oh.
Well, good afternoon. I'd start off with communicable diseases. First of all, last month we talked a lot about measles. We heard a lot about measles and vaccinations. We have been monitoring this closely, and, knock on wood, it seems as if the outbreak is under control. We've really seen no new cases over the last couple of weeks. A lot of the infrastructure in Clark County has been taken down. We're still monitoring. There's still active disease surveillance, but to date there have not been new cases in the last few weeks. We maxed out at 74, of which 73 of those cases were in Clark County. What we are seeing, however, is a lot of flu, and when I look at the curve here, we'll see that, and again, we're looking at the red line. You note that during the typical peak months of December, January, February, we weren't seeing what we had seen in previous years, but what we are seeing right now is a significant uptick in numbers, and that primarily reflects the fact that early on, most of the strain of influenza A was the H1N1, which had a very good match with the vaccine that was available. What we're seeing right now, however, is that the predominant strain of influenza A is an H3N2 that unfortunately doesn't have as good of a match with the vaccine. Earlier in March, the overall efficacy of the vaccine was about 47% for all age groups. It was 61% for children under the age of 17, youth under the age of under 17. I would suggest to you that we're probably going to see a lower overall effectiveness rate of this year's vaccine in light of the fact that we're seeing this uptick in H3N2 right now. To date, we've had 422 influenza hospitalizations, of which, again, 416 are influenza A. Only a third have been vaccinated. And again, note that this is only in hospitalizations to suggest that there are a lot more individuals who have contracted flu. We're just capturing only those that have been hospitalized. You can see the age groups here, again, disproportionately affecting seniors. And then I just note that deaths so far in Spokane County, 14% have been vaccinated. We have 21 so far. I was talking with a reporter earlier today. We had no deaths in the state through early December. The first one was noted in Tacoma Pierce. So the 114 deaths in Washington state due to flu have really been since probably mid-December. I just want to make you aware of some ongoing work that I've been involved with at the state. We unfortunately know this has become too much of a common problem over the last couple of years, And so in light of that, and really trying to get out in front of the issue, there's been a working group that consists of members from DOH, from Department of Ecology, local health officers, and we've been meeting on a monthly basis, sometimes in person. I enjoy driving to Ellensburg early on Friday mornings to meet. And what we're focusing on are 3 areas, they being a communication strategy which would be uniform and consistent across the state. Right now, it's very challenging because with different recommendations, different guidelines out there, depending upon which county you find yourself in, you may be finding yourself given information using a different guideline than what an adjacent county is. We may not be able to address that problem consistently this year, but we are really trying to pull it together so there will be better messaging. We're also looking at an increased number of sensors. There's a monitor, for example, called Purple, which are small monitors that you yourself can have and can give you a local reading. That said, we really need to understand how good those monitors are and then how they can be utilized in conjunction with other organizations and agencies that are putting information out there about air quality. And then finally, the group that I'm working on is around closures, specifically around schools and events. It has become a problem over the past few years where certain events, for example, the county fair in Kittitas County, fell during a time of significant air hazard. And then the question arose, well, should we close this? And if so, what are the financial and economic impacts of doing so versus the health impacts? So again, we're looking at coming up with some guidelines and recommendations, which we would then push forth to elected officials to then understand where their position is, where our role is in public health, and looking for some agreement and some coordination. Any questions around that? Yeah.
I just want to go back to the measles, because now it sounds like it's just kind of fizzled out. And I just wanted to know, how does it work? And I've asked this before outside the meetings, but how does it work with the media and getting the correct message out there on the measles outbreak and information? Some physicians at the U had said that, this was like 2 weeks ago, that the outbreak was mainly in a cultural, ethnic, Russian-speaking community and all those who are associated with. And they said it would just fizzle out, and that sounds like that's what happened. But the media is putting out a message that sounds like, but in this article here from the spokesman, it says that the Spokane County kids have received both MMR immunizations is 74%. And I looked right before I left, before I came here, and it said that for 6th grade, the Spokane County has 2 doses for MMR in 6th grade at 95.7%. So who does the messaging out there to the media?
So I'll address the first issue around the population that, again, we first saw the outbreak in. Yes, it was an Eastern European population. I think we talked about this last month, however. Of the 74 cases, the first, and I forget the exact number that Susan shared with me last, I want to say it was early 20s. About 20 plus individuals were directly connected to that group. The subsequent 50 plus individuals who contracted measles were not part of that ethnic group. Rather, they were contacts of those individuals. So I think we need to understand that of the total number of individuals who contracted measles, there were epidemiological links to that index case in less than a third. And 2/3 of those individuals were, again, community contacts who had been in those places where we've talked about where you are running risk of being in those places if you're unimmunized. And again, disproportionately, the vast majority, and again, I don't have the numbers in front of me, but there were very, very few. I want to say of the 74, we only had known vaccination rates of 2 of those individuals, and they were partially vaccinated. Of the other 72, they were either unvaccinated or no confirmation of vaccination, and therefore, from our standpoint, they were unvaccinated. With respect to the messaging, I think it's been challenging from the standpoint of maybe some misinformation that was, for example, presented earlier in public testimony. The IIS is a computerized system that is state level, and that is one that providers who are eligible and using the vaccines which are provided by the state, they provide that information. So from our standpoint, that is a means by which we know that providers have documented that these individuals have been vaccinated. There are other methods by which schools, communities also get information, but they're not always those that are coming directly from providers where the vaccines are occurring. So for example, and again, I see some of my immunization folks, and so I may defer to their expertise. So bear with me if I misspeak, please chime in. But there is one system whereby, for example, you as a parent, I as a parent, although I'm not, could hypothetically get a document and say, okay, my child has completed this series of vaccinations. Okay, I don't have record of it, but I don't have any proof of it from a physician or from a provider, but I will document this, and this is what I will give to a school. In many situations right now, that is what schools are relying upon if they don't have or they're not making use of the IIS. So the state actually uses 3 different means by which it attempts to triangulate actual vaccine rates. And I would suggest to you that using those 3 different methods, it has what I believe and what I've heard in testimony as well as in discussions with the experts in this area, giving very good statistics on vaccination rates, in contrast to what we sometimes hear in other domains. With respect to who controls the media, good question. Okay? I mean, we can get the information out there. We can provide statistics. We can provide the facts. What the media runs with is what the media determines it wants to put out there. So I think that will always be a challenge. Any comments from immunizations? I see a thumbs up.
Yeah. So I think
The Washington Immunization Information Center, that's not, that's voluntary. Those physicians and those providers who want to jump onto that
information system, is that correct? So the school, so are you saying with the parents who put in the certificate of immunization status, that those certificates are incorrect? That the parents are not putting in correct data?
I'm not saying, okay, I apologize. I'm not saying they're incorrect. I'm saying that they may be incorrect because they have not been verified. I think a wonderful example of this is my own niece who moved here from California. Okay, there was no way for them to document. We had no electronic medical record whereby they could, where her pediatrician in Southern California could send that information up to her pediatrician up here. So my sister-in-law ended up just writing it down. She therefore took that to the school, and therefore it's the school's responsibility to input that, but it's also the school's expectation that that information is valid. Okay? If, however, schools and the system is structured and has access to the IIS, then it is the provider's responsibility to do that documentation. And I, as an official, I, as a public health official, I, as a school official, know that I have a provider who is signing off on that, because that is one of the requirements of being a participant in the VFC program, which is the Vaccines for Children program, which is vaccines provided by the state to pediatricians and family medicine doctors. So I'm not by any means saying that parents aren't putting in the correct information. They may indeed be putting in the correct information. I have no means of verifying or validating that. There is, and I believe it is going to happen this year, that there is what's called a module that's going to be part of the IIS, such that and correct me if I'm, again, wrong, the school nurses are going to be able to input those data into the IIS and be able to verify that. I see heads shaking. Yes.
So they're going to be verifying the data that the parents are giving them?
They're going to be able to
If they're
verify.
able to.
They're going to be able to verify the data with the IIS. So again, a provider inputting that information, a nurse being able to get that information and verify that what they are receiving from the parents is what was validated by the provider. Any other
I just had a quick follow-up, and you might, but the question as it started was if something in the newspaper is, seems to be erroneous, is there a mechanism at the health district, in the communications department, to call the reporter, make a correction, put a press release, and say, no, that's incorrect data, we believe this is the following data? I thought kind of that was your question. How does that work? Who makes that? Who's checking the news?
The fact
does that?
checkers?
Yeah, and who's affirmatively acting if they see something that they feel is incorrect?
Yeah, I would say that's sort of a group process. Communication, certainly, we also defer to the experts. So certainly, be it the communicable disease, epidemiologists, be it the immunizations team, if we see misinformation that's being represented or misspoken, misstated, then we definitely are proactive in reaching out to do that. I'm just going to finish off with the legislative update. This is not my typical area of expertise. What I wanted to highlight, however, was if we look at what the board identified as its tier 1, 2, and 3 priorities, in your packet, there is a document at the very end that's sort of color-coded. And what we attempted to do was we used the WSALFO, the Washington State Association of Local Public Health Officials. We used their update that came out on Monday as a template, and we tried to cross-reference those priorities in Tier 1 that are highlighted in yellow. Tier 2, I think, is blue, and Tier 3 would be the, is it pink? So just with a couple of things, Foundational Public Health Services House Bill 1497, just before we came down here, we learned that it was approved by both the House and Senate, and so it's going forward, which we are very pleased by. The amount of money that has been allocated by the House is consistent with what the governor proposed, which was $22 million. That's not as much as we acknowledge is needed in this area, but nonetheless, it's an important contribution to keeping our work ongoing. T21, the engrossed House Bill 1074, it is likewise doing well. It's moving forward. And I think, again, there's reference to that document or to that bill on your pages there. I'm sorry to say that suicide prevention, which was a priority, we're not seeing as much coming out of the legislature, although it is in the governor's bill. There were only a couple of pieces that actually made legislation. They specifically were looking to address expanding the crisis center for Washington calls to the National Suicide Prevention Lifeline, a suicide prevention specialist at the Healthcare Authority, and community grants. The governor's bill called for $1.15 million. The House bill calls for likewise. We're still hopeful that we'll see some monies going to suicide prevention, which we acknowledge is a significant regional and national issue. Home visiting services, again, there is money in the governor's bill and in the House bill to support that. Some legislation is moving forward with that. Behavioral health, I couldn't identify a single bill, so again, there's a lot that touch behavioral health that are highlighted in yellow. And then finally, just around vaccine preventable diseases, as you are all well aware, the measles outbreak in Clark County generated 2 pieces of legislation and a variety of amendments. The Senate bill that would have removed personal and philosophical exemptions did not pass muster. The House bill, however, is moving forward. There is public testimony being heard on Friday, both here locally in Spokane Valley as well as on the west side. And hopefully we'll see some movement over the next couple of weeks on that particular engrossed House Bill 1638.
maybe somebody else knows this, but I think I saw in the news that actually the T21 did pass both the House and the Senate, so it's going to the governor.
Yeah, sorry, yeah.
But that was since Monday, I think. But secondly, this document, when it's got priority and position, that's the WASALFO.
Correct.
Priority and position, not ours.
Not
in case
yours,
somebody
not
looked at
yours,
that.
yeah. All I tried to do was to align priorities by color code.
Yep. So, Councilmember Thompson.
Yes, I did have one thing I wanted to share, that I'm with the Washington Association for Substance Abuse and Violence Prevention, and we've been following like 100 bills. One of the things that's moving through that I think is important for us to address is substitute Senate Bill 5643, which allows alcohol served in all theaters. And there are no restrictions around children's movies or days or times. And WASAP and many others have been testifying con on that bill. And so I just thought I'd point it out that there are a lot of things. There's also expansion of alcohol or been proposed expansion, tasting rooms and different things at distilleries, and no mention of stopping impaired driving or keeping children out of the tasting rooms, that kind of thing. But especially 5643, I think, is important for us to look at around the community norms with the effect alcohol has on our children and community norms.
Okay. Any other questions or concerns on the legislative agenda report? Anything else from you?
I'm not finished yet.
Okay. Continue
I just
on.
want to give you some updates. I passed out these cards, and we are having, as you know, we've had an opioid task force meeting on a regular basis over the last year and change. We're having a community event May the 7th at the Riverside Place, and it has information on that card. We have a keynote speaker. We'll also have a number of community members sort of speak to the issue. So I encourage all of you to attend. It's a free event. I'd love to see as many board members out there supporting the effort. We are also having a provider education event in conjunction with WSU, Eastern UW, and our Cora Foundation. We're having that event in June with the intention of increasing education and understanding about opioid usage and substance usage for providers. And then finally, the suicide prevention strategic planning process, we're finally getting that kicked off. Again, Heidi Wilson, who I point out at the back, who you've heard from in the past, she has been the key person in moving these initiatives forward, and so I'm very appreciative, and we are as well, for her work there. We're having a first meeting at the Endurance Training Center, April 22nd. We've sent out invites. If interested and you've not been on the invitation list, please let us know, and we will be more than happy to get you in the invite list. The idea is that over a series of meetings that Heidi will be facilitating, we're going to look to come up with a community-wide plan that we can then roll out. And please put all cell phones on vibrate. Thank you, sir.
It's time to go.
I've been up here for a long time. But the idea is to come up with a community-wide strategic plan on how we address suicide prevention. And that's all I have.
I'm going to go back. Can I just ask one more question here? Because I don't know, like homelessness with Kate, but I just want to ask, you said that 1638, that you were hoping that would go forward. Is that you personally, or has I missed something? Has the Spokane Regional Health Department actually have a policy in supporting mandated vaccines?
I represent the health officers on the Washington State Board of Health. Mm-hmm. And as a health officer, that's something that I have been with my peers supporting. So, Again, vaccines are definitely vaccine-preventable diseases, and vaccines against those is certainly a public health priority.
But that's not a board position. So, I mean, when we did our legislative agenda, that wasn't part of our, if that's your question, to clarify that.
Anything else?
Okay, thank you so much. And is there any financial report? None. Then we are going to go into an executive session regarding litigation, potential litigation, RCW 4230.110, parent 1, parent I. And estimated time?
5 minutes, top.
5 minutes, okay, so we'll do that for 5 minutes. We clear the room. We will come back and do a board member check-in, and we'll announce that to anyone who's waiting and wants to come back in.